Hi, I'm Jessica Mulch. I'm a speech pathologist at Ellinwood Hospital Clinic, and I would just like to talk to you a little bit about speech and language development in children. One of the things that I'd like to talk about today is naturally including speech and language skills in your everyday play at home. So a few important things to keep in mind: talking, babbling, singing, playing with your child are all great ways to encourage language development. We know that children learn words far before they actually use them. A few things you can do to encourage language development in your child include narrating your day. So as you're going about your daily tasks, including them in those things. If you're cooking dinner, using phrases like "Mom stirs the soup," "Mom likes soup," "Do you like soup?" and giving them time to answer. So sometimes that wait time can be really hard and can feel a little bit awkward as parents, but it is really important for that language development to give them time to think of a response and respond. One of the best ways to develop language is through those natural experiences. So if we're in the car, we're driving down the road, talking about what we see outside. I see trees. What do you see? The sky is blue today. There are clouds in the sky. Those are all things that can help encourage that word learning and word building as children continue to grow and develop. As parents, sometimes we question what milestones our children should be hitting and at what age, and we worry if they're on target all the time. So a few of the things that we can look for, typically I tell parents by age 2, we should be seeing about 50 words. We also see children start to combine those words. So we'll see short 2-word phrases such as "more milk," "mommy go," "car stop," all those good things that start to make more intentional communication attempts. So the goal is that we never stall. The goal is that we continue to see growth in our children. So we want to see new words picked up all the time, new words used in phrases, combining words. So the goal with our children at this age, at about 2 years old, is that we want to see continued growth. We want to see constant changes, new words being added to their vocabulary, word combinations, trying to communicate with you. Following simple directions is another big one. So being able to tell your child, "Can you point to the cow?" while you're reading a book, and seeing that they are able to point to the cow and understand those things that you're asking them to do. If your 2-year-old is not using words, or if you have concerns, sometimes it's just that parent intuition of, "I feel like something's not right." It's always okay and it's always appropriate to get them in for a speech screening or a speech evaluation as soon as you feel that it's needed. Another option here at the Ellinwood Hospital, we do provide free speech screenings. No insurance is required. It's just a call and schedule, quick 15-minute visit. That can give us a lot of insight on whether a formal speech evaluation is needed. One of the most common questions I receive as a speech therapist is, when should I start thinking about an evaluation for my child's speech and language? As a speech therapist, I think the bottom line is there's no perfect time, perfect answer, but there are a few things that we can look for that can help us to flag down now's an appropriate time for a speech evaluation. A few of the things that might be red flags for us as parents that we would look for to signal a speech evaluation include no attempts at words by 18 months. So around 18 months, we want to see children trying to start using single words like mom, dad, ball, play, go. If we're not seeing those things, that can be a time that we would encourage you to bring your child in for a speech evaluation. If your child is frustrated by communication attempts, if you feel like, "Man, we're trying and we're just not getting anywhere," that is a perfect time to bring your child in for a speech evaluation. If they're having a difficult time following simple directions, if you feel like they are not combining words by age 2. If they're 2 years old and they're still using under 50 words, that's a good time to bring them in for a speech evaluation. Another red flag to look for is if by age 3, you notice that family members and people close to your child are still having a really difficult time understanding their speech. That could be a good time to bring them in for an evaluation also. An important thing to remember is to trust your instincts. If something doesn't feel right, it never hurts to ask. You can always give us a call. We're more than happy to get them in for a speech screening to kind of check that out and help guide you on which way to go. A speech evaluation does not always mean something is wrong. Sometimes it just means that we are finding the way that your child communicates the best, and we're finding ways to support them in the way that they communicate. An important thing to remember is that early support can make a big difference. Typically, the earlier we can get a child started in speech therapy, the easier it is, and we'll see that growth really early on, which can impact school performance and all those important things that come later on in life.